I'm going to show you some techniques to self-manipulate or crack your low back. So first off, the biggest thing that we know about cracking our joints is that by and far the majority of the time your joint is not out of place and that you put it back in place. To my knowledge, there aren't studies that show, other than dislocation studies, but there's not studies that show back hurts, they x-ray, oh look, you're like out of joint, and then crack it and re-image, oh you're in joint. But there are plenty of studies that show, one, there's imaging studies that show when you crack your knuckle joints, like kind of gas bubbles moving out. And then two, there's studies that look at your muscle activation as well as the pain centers in your brain. And what we see is that when you get that crack, that you instantly your muscles become more active and the pain centers in your brain kind of calm down and you get that feel good effect. And then also we know that usually if you have a positive expectation that a crack will help, rocket science, it usually does, whether that's our brain knowing, our body, or placebo effect, who knows, but that's pretty common that if you feel like a crack will help, usually it does. Now I am extrapolating these studies to thrust techniques, so where we would actually do a high velocity, so it's quick but a low amplitude, so it's not to end range, manipulation. And actually in some of the studies with low back, what they've found is that it's not actually whether it popped or not, whether there was an audible pop, but it's actually the thrust itself. So I am extrapolating that you not doing a high velocity thrust and getting a pop will create those same effects. So I'm extrapolating a little bit, but in my own personal experience and patient experience, usually if you feel like you need to crack and you crack, feels good. Now, I usually do use that in my own life if I crack my back or my neck as a reminder that I probably need to get stronger and have my muscles have more strength and endurance so I don't get as fatigued and tired and feeling like I need that feel good pop, or controlling my joints better. So I always, if I crack, I'm fine. You're not gonna hurt anything. You can sometimes create a spasm and flare up, but you didn't harm anything. And I use it as a reminder of I'd still need to get stronger and control my body better. So anyways, for our low back, the best bread and butter technique is to lay on your back. Arms at your side. Take a leg, any leg. Roll it over. And you may or may not have picked up that pop on the video, and then you can go the other way. And you can pick a side, any side that feels best. And then this side's not going, so I'll kind of overpress there. And then since it's not, but it feels like it would feel good, another technique you can do is you can lay on a bed. I have a bench, I'd recommend a bed, and you'll lay on the side of the bed, okay? And then this just allows you to get more leverage. So I kind of want to try to get my left side. So basically, usually I'd stabilize on the bed. I'm going to stabilize on this bench, and then you come over, make sure I don't fall off the bed, and then kind of stabilize here, and no go there. And then on that, with me trying to force that, I totally did just get a little bit of a strain, kind of in my left QL. As I get moving, it'll feel better. So then lastly, the other thing you can try is in sitting, you could kind of try to rotate like this. I like to go standing. And so in standing, if I have like a wall or a post, I'll stabilize, I'll cross this leg over, and then I basically use that wall or post to turn. And that left side is just not going today. And then there. And so you can get a crack there. So you shouldn't be pushing into pain. Any tightness or discomfort should be like a hurt so good. May or may not get a pop, but it's not a bad thing to take your spine through those end range twisting motions. You're in very low load. Please, if you've had like a spinal fusion or something like that, please consult your physical therapist or your physician or your surgeon before you try something like this. So hope that is helpful. It can really help. And then if you do get that, then I should actually go and get some core work. If you have acute low back pain and that helps, then definitely either work into your directional preference or your stabilization exercises to then continue to improve. So the pop is actually just bailing some water out of the boat to allow us to better find and fix the leaks. It's not this magic cure-all. So we need to attack our problems after that. So I hope that helps. Yes, it's okay to crack your back if you want to. Just make sure to address your other issues as a result. Happy cracking.